and welcome to our online seminar. We will be discussing Gastroesophageal Reflux Disease, or GERD, also known as chronic acid reflux or chronic heartburn. We want to thank you for taking the time to learn more about the condition. During the seminar, we will be discussing the causes and symptoms of GERD, why it needs to be treated and kept under control, and what the consequences are if left unchecked. We will then discuss lifestyle change, non-surgical medical treatment, and surgery to address GERD and its various symptoms. GERD can occur for a number of reasons. It is most often attributed to weakness in the lower esophageal sphincter, or LES. This is the one-way valve between the esophagus and the stomach that allows food and drink to enter the stomach but prevents the stomach's acidic contents from coming back up into the esophagus. For various reasons, the LES can weaken, and stomach contents can leak upwards. The most common causes and risks for GERD include excess weight or obesity, pregnancy, any condition that places added pressure on the abdomen, a hiatal hernia, poor eating or drinking habits, obstructive sleep apnea, smoking, and genetics. GERD can also be worsened due to weight loss surgery and specifically the gastric sleeve. If you have new or worsened reflux after your gastric sleeve procedure, it is important that you speak to an experienced general surgeon to learn about the options to minimize reflux either with a revisional procedure or a specific surgical procedure for GERD. The symptoms of GERD can vary between patients. Sometimes patients do not realize they are suffering from GERD because the symptoms don't match what we typically believe them to be. The most common symptoms include an uncomfortable or painful burning in the middle of the chest. This can be severe to the point that some patients mistake it for heart problems and end up in the emergency room. The pain from acid reflux can also migrate to one side or even the back. The pain is also sometimes felt in the shoulders and neck. Chronic dry cough caused by the irritation of the esophagus. Sore throat. Regurgitation or the feeling of voluminous contents in the throat or mouth. Yellow teeth and/or eroded enamel. Bad breath. Bad taste in the mouth or back of the throat. Difficulty swallowing, potentially H. pylori infection. In rare cases, difficulty breathing. For many, chronic acid reflux is a way of life. But without knowing why GERD is truly problematic, too many patients do not seek help until the disease has progressed. The main concerns include a narrowing of the esophagus, known as esophageal stricture, resulting from inflammation that in moderate cases may make it difficult for the patient to swallow, but in severe cases can impede breathing. The acid in the mouth can cause enamel of the teeth to erode and subsequent tooth decay, sensitivity, and other problems. Unfortunately, these consequences are irreversible. Nighttime coughing or choking with increased potential for aspiration that can cause breathing issues and possibly even lung damage or pneumonia. The constant wash of acid in the sensitive lining of the esophagus can cause negative changes on a cellular level. This is known as Barrett's esophagus and is considered precancerous. An endoscopy followed by a biopsy is sufficient to diagnose Barrett's esophagus. Some patients, up to 20%, with Barrett's esophagus risk eventually developing esophageal cancer. While overall risk is still low, the relative incidence of esophageal cancer has increased tremendously over the past couple decades. Upon diagnosis of GERD, your physician will suggest lifestyle change as the first course of action to mitigate symptoms and halt esophageal damage. Changes will include losing weight, eating fewer processed foods, eating smaller meals, avoiding caffeinated and acidic foods like chocolate and citrus, and beverages, soda and coffee, as well as avoiding spicy and fatty foods. We will also recommend that patients do not eat within 3 to 4 hours of bedtime, but do recommend they sleep with their upper body elevated, using pillows or an adjustable mattress, or sleeping on their left side, reducing stress and increasing exercise. Avoiding alcohol and smoking is also helpful. While some patients are able to mitigate the effects of GERD through lifestyle change alone, this change is often hard to maintain. And when patients return to their prior habits, they also experience worsening symptoms. For those who are not able to modify their lifestyle sufficiently to get substantial relief from GERD, there are several medications that can help. This is usually the next, most prudent step in treatment. Your doctor will prescribe one of a few possible options. While occasional acid reflux can be managed with antacids like Tums, different medication will be considered once the acid reflux becomes chronic. H2 receptor antagonists, such as Pepcid, use histamine blockers to lower the production of acid in the stomach. Zantac, another very popular H2 antagonist, was recalled in March 2020 and should not be taken. These medications, while popular and effective with relatively low side effects, have been overshadowed by PPIs. PPIs, or proton pump inhibitors, including omeprazole, brand names include Prilosec, Nexium, Prevacid, and Zegerid, are another class of over-the-counter drugs that effectively inhibit the production of acid in the stomach and reduce GERD symptoms. Side effects are generally mild and well tolerated, but links to osteoporosis, kidney disease, dementia, and heart disease are being studied. These medications are indicated for short-term use only, typically 8 weeks. With more and more patients taking PPIs for years, even decades, the concerns over potential long-term side effects have been growing. While medication can be very effective for some, it is important to remember that these options only treat the symptoms of GERD, not the root cause. Therefore, once medication is no longer taken, the reflux will return. For some, medication simply isn't a viable option. Medications can cause side effects that can be unacceptable for some patients. For others, medication does not sufficiently resolve the reflux problem. And more patients are becoming concerned about the potential side effects of using these medications for long-term use. These patients may be candidates for anti-reflux surgery. Surgical treatment for GERD may seem like a drastic recourse, but when lifestyle change and medical intervention do not work, surgery is an option that can offer significant long-term relief. Traditionally, GERD has been treated using a surgical procedure known as fundoplication, where the top of the stomach pouch, the fundus, is wrapped around the lower part of the esophagus. This adds pressure on the LES and prevents food from refluxing back into the esophagus. Fundoplication requires about an hour of operative time and a 1 to 2 night stay in the hospital. Post-operative recovery is similar to that of other major abdominal procedures and can take up to 6 weeks before normal activity and lifestyle can be resumed. During this time, patients will have to follow a modified dietary plan to allow the stomach to recover. Gastric sleeve patients wishing to improve new or worsening reflux will not be candidates for a fundoplication, as the fundus of the stomach is removed during the sleeve procedure. While we do not routinely screen for it, a hiatal hernia is sometimes found incidentally during testing for other conditions. Further, we look for and often correct a hiatal hernia during a primary weight loss surgical procedure. While detecting and treating a hiatal hernia on its own is less common, we do consider screening if GERD cannot be explained by any other reason. A Nissen fundoplication is indicated for paraesophageal hiatal hernias, where the stomach pushes through the hiatus and lodges next to the esophagus, increasing the risk of strangulation of stomach tissue. Otherwise, for sliding hernias, a suturing procedure is often sufficient to correct the hernia and reduce symptoms. An innovative medical device known as LINX Reflux Management System has been introduced to address many of the pitfalls of fundoplication, while also offering most of its benefits. The device, which is about the size of a quarter and looks like a beaded bracelet, is placed around the lower esophageal sphincter and closed using a magnetic clasp. Its small titanium beads expand when food and liquid come down the esophagus, allowing entry into the stomach. However, it creates enough pressure to otherwise keep the LES closed so that stomach contents do not reflux back into the esophagus. LINX is available to many patients for whom medical treatment has not worked well or cannot be tolerated. LINX has also been used successfully in patients who have acid reflux after their gastric sleeve procedure. Without the presence of a hiatal hernia, the LINX procedure takes about 15 to 20 minutes and is often performed on an outpatient basis, meaning that patients can leave for home on the same day as surgery. Unlike a fundoplication, patients are encouraged to eat soft and solid foods as tolerated immediately after surgery. LINX patients are coached to use eating as physical therapy for their device as the body heals from surgery. LINX also has drawbacks, and these can include all of the potential risks inherent to a major surgical procedure and general anesthesia. LINX patients may have difficulty belching and vomiting. However, these functions will be much improved versus after a fundoplication. Patient studies have reported that the improvement in GERD-related symptoms is similar to the results of fundoplication at about 90%. As with any medical device, there is a small risk of needing it removed, known as explantation. One potential benefit of the LINX procedure is that scar tissue developed as a result of the device implantation creates its own pressure on the LES. Therefore, if the LINX device needs to be removed, many patients continue to see some benefit. Thank you for watching our seminar. To understand the best options for your particular circumstance, we ask that you schedule a consultation with our office. We will evaluate your medical history and your symptoms and recommend a path forward. In the meantime, we encourage you to contact us with any questions you may have.